ASCO this year is an extremely interesting time to look at tumor-infiltrating lymphocyte therapy for melanoma and also for other solid tumors. I'll highlight a couple of abstracts. One is going to be presented in the oral abstracts for melanoma by Alison Betoff-Warner from Stanford, and it looks at the TIL therapy, a novel therapy from Obsidian. This OBX therapy is um, changed in a way to express IL-15, and therefore you don't need IL-2. There are some benefits to having IL-15, but utilizing this TIL, you give a pill that releases IL-15. And so you don't need to do the IL-2 infusions, you don't need the ICU. Um, but what we saw here getting to the bottom of it is a 63% response rate. That's a very high response rate, and a 93% disease control rate. And that is similar to what we saw in the phase 1 study that was done at MD Anderson. What we've also found is a different way to use TIL because you can give these pills that release IL-15, and because you have residence memory TIL in your body, you can continue to bolus treatment even when they're out of the hospital. So you can reignite their TIL if you see that they're not having as great of a response as you want, or somewhere down the line the memory T cells can be reinitiated to bring back response. So I can't wait to see this. I think it is pushing the limits of what we can do for TIL and possibly decreasing toxicities that we see with standard TIL with interleukin 2. This year at ASCO, there's a different face on TIL therapy. The group at UPMC is going to be presenting TIL therapy for solid tumors where you really wouldn't think that TIL would work. And that's in the developmental immunotherapy session, where they'll show their experience with TILs for patients who have pancreatic cancer, uveal melanoma, and mesothelioma, including other rarer tumors for immunotherapy, and utilizing a signature that they have that they get from a core biopsy that can identify patients who have a higher chance of responding, take those patients to tumor harvest, and get responses alongst the line of 50%. So this shows what I've always believed, that when you show proof of concept for immunotherapy in melanoma, that's just the starting point to benefit in other solid tumors.